as I told you in our discussion, after irreversible injury, there will be cell death and there will be certain morphological changes, right? So these were the morphological changes. So we will discuss about number one, necrosis, right? So first we are going to discuss about number one, necrosis. So number one is necrosis. In necrosis, what we need to understand, there will be two patterns of necrosis in any cell after the cell death, right? So there are two patterns of, so always remember there are two patterns of necrosis. What are these two patterns? What are these two patterns? Number one pattern is called as coagulative necrosis. Coagulative pattern of necrosis. This is the number one. And the number two is liquefactive necrosis. Number two is liquefactive necrosis. So these are two patterns of necrosis. Coagulative necrosis is the most common pattern of necrosis. So these are some basic questions which examiner ask in exam, right? So keep in mind, most common pattern of necrosis is the coagulative pattern of necrosis. Now we will see the concept, why they are coagulative and why they are liquefactive, right? In coagulative necrosis, in coagulative pattern of necrosis, why it is coagulative, right? So we can understand this by seeing this. Coagulative necrosis is because of denaturation of the protein. So concept behind coagulative necrosis is denaturation of proteins, right? So whenever there is a denaturation of protein, what will happen to a tissue or to a cell, right? So whenever there is a denaturation of the protein, only protein architecture, only protein will be denatured, but overall tissue architecture will be preserved. That is very important to understand. In the beginning phase of necrosis, tissue architecture is usually intact. That is because of denaturation of the protein, and this will be called as coagulative necrosis. So always remember what I was saying, denaturation of the protein, tissue architecture will be preserved. Because of the denaturation of the protein, there will be tissue architecture, and tissue architecture will be preserved. That is very important. Tissue architecture is preserved in coagulative necrosis, right? This was the question in All India exam 2015. Tissue architecture is preserved in which pattern of necrosis? So tissue architecture is preserved in coagulative necrosis. So that was the question. So keep that in mind. Tissue architecture is preserved in coagulative necrosis. So that was the question in All India exam, right? So in coagulative necrosis, denaturation of protein is the pattern where tissue architecture is preserved, and that is why it is called as coagulative necrosis. Whereas when we talk about liquefactive necrosis, pattern is because of the, lysosome permeability will be increased, and due to increased lysosomal permeability, enzymes will leak out. So basically it will be having enzymatic damage of the cell, right? So it will be having enzymatic damage of cell, right? So whenever there is an enzyme which is acting on any tissue or any cell, so they will cause hydrolysis, right? So basically enzymatic damage is hydrolytic damage. So we can say it will be hydrolytic damage, hydrolysis. So it means to say that they will liquefy the tissue, and in a liquefied areas or in liquefied things, you will never find any tissue architecture, and that is why tissue architecture will be lost in liquefactive necrosis. So because of this, tissue architecture will be lost. Tissue architecture will be lost in liquefactive necrosis, right? So in tissue architecture will be lost in liquefactive necrosis, tissue architecture will be preserved in coagulative necrosis. These are the very important things we have to keep in our mind to understand future discussion also, right? So now we will see what are the example of coagulative necrosis, right? What are the example of coagulative necrosis? Coagulative necrosis will be seen in ischemic infarction of the solid organs, right? So what I said, ischemic infarction, ischemic infarction. So hypoxia ischemia is the basic root cause for coagulative necrosis, and ischemic infarction of the solid organs, as I said, ischemic infarction of the solid organs, right? So I'm saying ischemic infarction of solid organs. So what are examples of solid organs? So here I would like to mention the number one and the most common. This was the All India question in 2014, right? NEET exam. They are fond of this kind of MCQs, right? Which organ is most commonly affected by coagulative necrosis? So always keep that in mind. It is heart which is most commonly affected by coagulative necrosis. Heart, right? And remember, the patient who is coming to the OPD with severe chest pain, right? Angina, infarction, myocardial infarction, heart is most common organ affected by coagulative necrosis, right? So after heart, another important thing we have to remember here, other solid organs are kidney or liver. So these are some of the solid organs where you will be finding coagulative necrosis. So ischemic infarction of solid organ, tissue architecture will be preserved, and most commonly heart will be affected, which was the question in All India exam. All solid organs and in all ischemic infarction you will find coagulative necrosis, except, remember, exceptions are very important MCQ. So what is that exception? Brain tissue. Remember, brain tissue. Whenever you are seeing ischemic infarction of brain, ischemic infarction of brain, one of the very famous and very often asked question in exam. So just keep that in mind. Ischemic infarction of the brain, what kind of necrosis you will observe? Liquefactive necrosis, right? So why liquefactive necrosis will be seen in brain? Why not coagulative necrosis or other areas, ischemic infarction in solid organs? But when we are talking about brain, so you know that when we are dissecting brain during anatomy session, what we have seen, brain is a very delicate, right? It's a pulpy, soft. Why it is pulpy and soft? Because there is no collagen in the brain. Remember this point. Brain does not have collagen, and collagen is required for stromal support. Why these solid organs are solid and they are having coagulative necrosis? Because they are having stromal support. Stromal support is given by collagen. So solid organs, stromal support, collagen. But when we are talking about brain, a pulpy organ, and there is no collagen, no stromal support. So why it is showing liquefactive necrosis? Because there is no stromal support. Number one, no stromal support. Why there is no stromal support? Because there is no collagen in brain, right? So there is no collagen in brain tissue. That is why they are having no stromal support. So this is number one reason why there is a liquefactive necrosis. And number two reason, brain is rich in liquefactive enzyme. Brain tissue is rich in liquefactive enzymes, right? So brain is rich in liquefactive enzymes. So these are two basic reasons. Remember, these are two basic reasons why brain should have a liquefactive necrosis, right? Apart from that, liquefactive necrosis will be seen in infections also. So just keep that in mind. In infections also, whenever we are seeing any infections, during infections, bacterial enzymes will be released and they will cause liquefactive necrosis, right? So these are the two patterns of necrosis which we have discussed: coagulative, liquefactive. Coagulative is most common, tissue architecture will be preserved. Liquefactive is less common, tissue architecture will be lost, right? So we have discussed about two patterns. Now we will discuss some of the special type of necrosis which examiner ask in exam. A special type of or a special pattern of necrosis. So I am going to discuss a special type of necrosis. So I'm going to discuss special types of necrosis. So what are these special types of necrosis? Right? I will just name some of them and then we will start discussing about them. Right? Number one is gangrene. Right? So number one is gangrene. After that, we are going to discuss number two, and number two we are going to discuss is the caseous necrosis. Caseous necrosis. Right? So number one, gangrene. Then we will discuss about caseous necrosis. And third one is fat necrosis. Right. Third one will be fat necrosis. And fourth one will be fibrinoid necrosis. Fourth one will be fibrinoid necrosis. Fibrinoid necrosis, it's very important because this was the question in this All India exam. So just keep that in mind, fibrinoid necrosis. So these are the four special patterns of the necrosis I will briefly discuss with you. Right? So number one, I am going to talk about gangrene. What is special about gangrene? Gangrene, when you will see, number one, you will observe the most common site which examiner asks. What is the most common site for gangrene? Most common site for gangrene is the lower limb. So most common site for gangrene is lower limb. So whenever patient will come to the OPD, you will observe he is showing his lower limb and there will be some characteristic loss of blood supply. There will be some grayish or black color lesion on his foot or in his leg. So that is gangrene, right? So lower limb is the most common site. Now here I want to tell you two important things. Gangrene, when you talk about gangrene, when nothing is mentioned like this gangrene, we should consider them as a dry gangrene, right? So gangrene, again, we can divide them into dry gangrene and wet gangrene. When nothing is mentioned, I just urge you to understand this will be dry gangrene and there will be some superimposed bacterial infection, then this will be called as wet gangrene. So there are two types of gangrene, dry gangrene and wet gangrene. What is the difference between dry and wet? Why it is called dry? Because in dry gangrene only loss of blood supply will be there. Remember, loss of blood supply will be there, but tissue architecture will be preserved, right? So this patient, when he will come to the OPD, you will be seeing lower limb. Patient is showing his leg, and in leg you are finding that there is a dark or gray color discoloration will be there, but still tissue architecture is preserved up to certain extent. So in dry gangrene, what I want to tell you, that tissue architecture is preserved, right? Tissue architecture is preserved. So if tissue architecture is preserved, then what is your opinion? What do you say? What do you say? Dry gangrene is example of coagulative necrosis or liquefactive necrosis. Did you understand why I was emphasizing that coagulative necrosis, tissue architecture will be preserved. So dry gangrene, tissue architecture is preserved. So dry gangrene is an example of what type of necrosis. When examiner asks you, you have to understand it's a coagulative pattern of necrosis. So coagulative pattern of necrosis is seen in dry gangrene, right? Same way, the same patient who came to your OPD with the dry gangrene, after 2 months, say he was suffering from diabetes, his immunity was compromised, bacteria came, and now the bacterial superimposed infections, bacterial contaminations, so that will induce wet gangrene, right? So what I am telling you, bacterial contamination. So because of bacterial contamination, there will be toxins and enzymes, right? So see what I am writing, there will be release of toxins and enzymes, right? Toxins are enzymes. So these toxins and enzymes, what they are going to do, they will cause hydrolysis of the remaining tissue. So such patient, when they will come to the OPD, in those patients you will notice they are having blisters, which is having fluid, serous fluid or fibrinous fluid. So that is why it is liquefied, right? Because it has been liquefied. Blister is containing liquefactive necrosis. So this is an example of liquefactive necrosis, right? So in this you are seeing example of liquefactive necrosis, right? So that is how we have to understand this is example of liquefactive necrosis, right? So that's the very important point to understand when examiner talk about gangrene, dry gangrene, wet gangrene. Dry gangrene architecture is preserved, so it's a coagulative. Wet gangrene architecture will be lost because of the liquefaction of the tissue, because of the toxins and enzymes of the bacteria. So this is a liquefactive, right? So this point we have to keep in mind for the gangrene, right? Now we'll move to the next special type of necrosis, that is the caseous necrosis, right? Why it is called as caseous necrosis? Now question comes to our mind, why it is called as caseous necrosis? Because of the cheesy appearance. Cheesy appearance when? Gross examination. When you are seeing a tissue, that will be showing cheesy appearance. So remember, this cheesy appearance you will notice more beautifully on gross examination. How you will identify cheesy? What your mind should read? Mind should read yellow or yellowish white. Yellowish white debris will be present in tissue. So yellowish white debris when you are seeing in a tissue, it means you are seeing a cheesy substance. It means it's a caseous necrosis, right? So in caseous necrosis, first I would like to give you one example. A very famous example of the caseous necrosis is the TB, right? So caseous necrosis is seen in TB, right? And this cheesy substance is due to, so this was the question in All India exam 2016. Why caseous necrosis is caseous, means why it is cheesy, why it is caseous. So when examiner says why it is caseous or cheesy, so remember it is due to cheesy due to presence of mycolic acid, due to presence of mycolic acid, right? It is due to presence of mycolic acid in the bacterial cell wall. Because of the bacterial cell wall will be having mycolic acid, and that is the reason for the caseous or cheesy necrosis, right? So in TB inflammation you will find caseous necrosis. Gross appearance will be cheesy, yellowish white debris or tissue debris will be there, and on microscopic examination, so when you will see the microscopic examination of this caseous necrosis, what we need to understand, initially you will find coagulative necrosis. So what is caseous necrosis? That was the older All India question also. What is caseous necrosis? Is it a liquefactive pattern or coagulative or both? So answer should be both. So it's a both coagulative and liquefactive. So that is the important point we have to understand. It is both coagulative and liquefactive necrosis, right? So both coagulative and liquefactive necrosis will be present on microscopic examination. So that is very important to understand. Coagulative and liquefactive both will be present in caseous necrosis, and how we will identify on microscopic examination. That is important. How you will identify on microscopic examination. So remember this word which I am writing here, right? On microscopic examination, this will be described as a amorphous. See, already I have told you in reversible injury and irreversible injury, amorphous. It's a very simple to understand. See this, amorphous. Morphous is derived from morphology. When you see a clear-cut morphology, that is called as morphous, and when there is no morphology, that is called as amorphous, right? So this is amorphous, means there is no morphology. Amorphous, granular, granule-like, amorphous, granular, pink structure. This is how we describe caseous necrosis on microscopic examination. Amorphous, granular, pink structure. So this is caseous necrosis. Because coagulative necrosis is present in caseous necrosis, that is why sometimes caseous necrosis is also described as a variant of coagulative necrosis. Sometimes you will find this wording in your textbooks, variant of coagulative necrosis, right? So it's variant of coagulative necrosis. So this is about the caseous necrosis. Here I would like to show you the picture, the diagram of coagulative and liquefactive necrosis, so that we can understand why I said like this, coagulative necrosis tissue architecture will be preserved. Now look at this one. This side, you can see this side I am showing you, this is the coagulative necrosis, right? This side I am showing you, this is the coagulative necrosis, right? In this coagulative necrosis, you can see it's a kidney specimen, histological examination, where I am showing you these are the tubules, right? You can see the tubules are visible here, but what we are seeing these are just eosinophilic cells. Remember what I am writing, these are just eosinophilic cells, and these eosinophilic cells are necrotic. These eosinophils are having necrosis, eosinophilic cells are having necrosis. So necrosis, how I say that it is necrosis? To understand that, we must understand in necrosis what will happen, because it is happening after cell death. So nuclei are not visible. You can see there will be no nuclei, but you can observe that tissue architecture is preserved. But there is no nuclei. There is no nucleus in any of them. So nucleus is absent, tissue architecture is preserved. So that is why I said it's a coagulative necrosis. So we are seeing a renal tubule, cells are, their outlines are visible. Only thing, we are not identifying any nuclei. That is why it is a coagulative necrosis, tissue architecture is preserved. Whereas on the other hand, when you observe this area of this picture, which I am showing you here with the arrow, this is example of liquefactive necrosis. This is example of liquefactive necrosis. So you can see that in this liquefactive necrosis, you cannot observe any outline of the cell. See, it's a purely eosinophilic area. No cellular architecture is preserved. This is another specimen of the kidney only, right? But you cannot see any tubule, anything, because that cell outline has been lost. So it's liquefactive. So that is what we have to understand. Coagulative, tissue architecture preserved; liquefactive, tissue architecture is lost. Look at this picture. This is the special type of necrosis, and in this area, this is the gross picture of the lung tissue, and you can observe this area which I wanted to focus. This area, and especially this creamy area, you can see here, you can see yellowish white cheesy appearance. Yellowish white cheesy appearance. So that is what I was telling you. Cheesy means caseous. Yellowish white cheesy appearance because of presence of mycolic acid. So this is the caseous necrosis. So this entire structure we are seeing is yellowish white caseous necrosis or cheesy necrosis, right? When we will take out the histological examination of the area, you will observe like this, and in this histological examination, never forget rule of 5, rule of observation, rule of comparison. So 5 areas, 1, 2, 3, 4, all 4 corners, and in the center. So when you are seeing and observing, so what you are observing when you are looking at the center, some cells are visible, and in this area you can see these are the mononuclear lymphocytic infiltrate, right? And when you are coming here also, you can notice some of the cells along with mononuclear cell. Here also you can see, notice some cells. But when you are focusing on the center, can you notice this area which I am showing you? Just notice this area which I have outlined. They are amorphous, granular, and more pink. You can see they are more brightly pink in comparison to the surrounding area. So this is what we describe as a amorphous, granular, pink appearance. Amorphous, granular, pink appearance, and this amorphous, granular, pink appearance is called as caseous necrosis, right? This is called caseous necrosis. So that is how we describe caseous necrosis. Amorphous, granular, pink area is the area of caseous necrosis, right? So this is the caseous necrosis diagram. Next pattern of necrosis is the fat necrosis. Another important and commonly asked question, and fat necrosis diagram was asked in All India exam 2016, right? So that was the question. The diagram was question in exam. What is fat necrosis? Fat tissue, fatty tissue will be having necrosis. So in fat necrosis, what we need to understand? Fat necrosis, what we need to understand? Fat necrosis can be of two types. Maybe because of the trauma, or it may be because of enzymatic activity. Maybe because of enzymatic activity. So it may be because of the trauma or maybe because of the enzymatic activity. Trauma example will be simple, breast tissue. So whenever there is a breast trauma, right, whenever we are seeing a case of breast injury, you will notice there is a fat necrosis or enzymatic. You can see in case of acute pancreatitis. You can see in the case of acute pancreatitis. So in acute pancreatitis, what will happen? So that is the point which I wanted to describe here. In acute pancreatitis, lipase will be released. So this lipase enzyme will be released. We all know that name itself is signifying. They will act on the lipid lipase. So they will damage the lipid and they will release fatty acid, right? So lipase will act on lipid and they will release fatty acid. So this fatty acid which has been released from the fatty tissue, they will combine with the calcium, right? So they will combine with the calcium. So fatty acid, when they combine with calcium, this process is called as saponification. So you might be reading all these terminologies, right? But we need to understand what is the meaning of all these things. Saponification, right? Fatty acid combines with the calcium. This is called as saponification because calcium is involving this fatty acid. So what will be the gross appearance when you are looking at the gross picture of the sample? Gross, you will find, see, just a rough diagram. I will show you the image after that. Suppose I'm showing you this is the gross tissue sample and I wanted to show you fatty area. So fatty area will be like this. This will be small. This will be like this, chalky white. So I wanted to show you. I will show you that diagram. Just remember how to understand, how your mind should perceive how to identify this saponified areas or fatty acid calcium. They will be looking chalky white appearance. So this chalky white appearance was the catch point of the question in All India exam 2016, right? So when image was shown in exam, you have to be very careful. Chalky white area, whitish area will be seen in the fatty areas. It means it is the fat necrosis and these are the lipase induced saponification, right? So this is the gross examination. What will happen on microscopic examination? How you are going to see on microscopic examination? So I wanted to tell you how you will see the fatty tissue. See, I am showing you 4 fat cells, right? So I am showing you 4 fat cells. These are fat cells. How you will identify fat cells? Fat cells will be clear, right? So they will be having clearer cytoplasm like this, right? So you can see cytoplasm will be clear. Cytoplasm will be clear and you will be seeing nucleus eccentrically like this. So eccentric nucleus will be there. So this is the exact structure of the fat cells you will observe in cytology as well as histopathology, right? So fat cells are visible like this. So what we are going to see next? So this is the normal fat cell, viable normal fat cell. But when there is a fat necrosis, so now I just wanted to demarcate this. Okay, this one which I have shown you is the normal one, right? Normal one. Now in rest of the 3, I want to show you the pathology. When there is a necrosis, what will happen? So when there is a fat necrosis, there will be no nuclei. So it will be like this. Nucleus is not there. Nucleus is not there and cytoplasm will be eosinophilic like this, right? So there will be no nucleus in any of them. There will be no nucleus in any of them. So these are anucleated fat cells. So how we describe, these are anucleated fat cells, right? Anucleated fat cells sometimes also described as a ghost cell, right? They are also called as ghost cell because there is no nucleus, right? So none of them will be having nucleus. Here it was nucleus, but none of them is having nucleus. So these are the ghost cell. And moreover, when you will observe inside the fat cells, you will find what I am showing you. These are amorphous basophilic calcium deposit. Calcium will be this like this only, right? So that is how you have to identify calcium. How you will identify calcium? Because see what I have said, saponification, there will be calcium, right? There will be calcium. That calcium is reason for chalky white. And when you are seeing them on microscopic examination, how this calcium will be visible? So this calcium will be visible as a, so this is how we describe amorphous Amorphous, again, amorphous, no morphology. How it is the color? Basophilic. Amorphous basophilic deposits. Amorphous basophilic deposits are suggestive of calcium deposition. So that is the important thing. We have to keep that in mind whenever we are reading pathology. When we are seeing a amorphous calcium deposit, they will be always blue color. So amorphous basophilic deposit will be suggestive of calcium deposit. This is how we will identify fat necrosis. Again, I would like to show you this diagram, which similar picture was asked in NEET exam. So you can see this is the omental fat, where you can see the fat necrosis. In this fat necrosis, if you observe, never forget rule of 5, as I said, 1, 2, 3, 4, 5. And when you are observing, if you look at this area, so whatever I am marking, you can see small whitish area in comparison to the surrounding tissue. That is why I said observation and comparison is very, very important, right? So you can see these are the small areas where you can see very whitish area. So these are the chalky white deposit, which I was telling you. This chalky white deposit is nothing, it's a fat necrosis, right? So that's what I was telling you, it's a saponification of the fat necrosis, right? So fat necrosis, chalky white areas are visible. So these are chalky white areas are fat necrosis, right? And when you will see the microscopic examination, so now I will show you, that's what I have shown you. This is the normal area. You can see I have written here normal fat tissue. So these are normal fat tissue. You can see the clear area and nucleus is at periphery. So this is normal. Now you compare the fat necrosis. Look at this area. When we are seeing the necrotic area, it is looking hemorrhagic also. And now you can see when we are seeing one cell, I am marking surrounding them. See this fat cell, you're not seeing any nuclei, anucleated fat cell or ghost cell. And if you see some of the surrounding cells, you can notice these are amphophilic, we can say, precisely because of the appearance of the PowerPoint, but it should be assumed that it's a little basophilic only, right? So amorphous, there is no morphology, amorphous basophilic deposit. So anucleated fat cells, amorphous basophilic deposits. As you can see here, it is more clear in this cell. If you look at in this fat cell, amorphous basophilic deposits are more clear, and in this one again you can see the same thing. You can see so many normal fatty tissue, and in this area you can see the fat necrosis, and inside the fat cells cytoplasm you can see amorphous basophilic deposits of calcium. So this is the another high power view, and here you can see beautiful white background, and this background is the clear cytoplasm of the adipocytes. You can see clear cytoplasm of the adipocytes, and this is the beautiful picture of the amorphous basophilic deposit. So just keep that in your mind. This is how calcium will be visible on light microscopic examination. Calcium, remember how it will be looking like? Amorphous basophilic deposit, right? So this is how we will identify fat necrosis. So the last one we are going to study about fibrinoid necrosis. Fibrinoid necrosis, this is a kind of a misnomer, right? Usually epithelioid does not have epithelium, right? So any oid, they are having, that thing will be absent, but in case of fibrinoid, fibrin will be present. Remember this point, fibrinoid, fibrin will be present. So in fibrinoid necrosis, what is present? Fibrin is present. Then why it is called as fibrinoid? Because along with fibrin, there will be presence of immune complexes, right? There will be having presence of immune complexes in the form of antigen antibody combination, right? So that is why it is called as fibrinoid. So that name oid is because of, so this oid name is because of immune complexes are also present along with the fibrin. So immune complexes, so that is how we can understand, that is how we can correlate the pathology of the fibrinoid necrosis. What could be the pathology of the fibrinoid necrosis? Pathology will be immune complex mediated, where they will be damaging the vessel wall, and when vessel wall will be damaged, just example I am telling you. So vessel wall will be damaged, coagulation pathway will be started, and we all know that in coagulation pathway fibrin will be formed. So fibrin and immune complexes will be there in fibrinoid necrosis. So what will be example for fibrinoid necrosis? So fibrinoid necrosis, example will be, as I said, vessel will be damaged, so it will be seen in vasculitis. And vasculitis example is polyarthritis nodosa, right? So polyarthritis nodosa you will be seeing. So this vasculitis is one example. So in vasculitis you will be finding fibrinoid necrosis. This was the all India question this time, so we have to keep that in mind. Apart from the vasculitis, it can be also seen in malignant hypertension. It can be also seen in malignant hypertension. So malignant hypertension, polyarthritis nodosa, these are two examples where you will be seeing fibrinoid necrosis. What will be the appearance of fibrinoid necrosis when you will be seeing them on microscopic examination? So just I wanted to demonstrate. Suppose I am showing you a blood vessel. Suppose I am showing you this is the blood vessel and this is the lumen of the blood vessel. See, this is the lumen of the blood vessel, right? So I am showing you a lumen of the blood vessel and there is a vessel wall. This is the wall, right? Blood vessel wall. On the wall of the blood vessel, you will be seeing pink deposits. So I'm just showing you these are the pink deposits. So this pink deposit is the fibrin plus immune complexes. Because of the endothelial damage, fibrin will be released, antigen antibody complex, along with the fibrin they will be forming fibrinoid. So this pink structure which we are seeing here, pink amorphous structure which we are seeing here, see this, I'm just writing pink amorphous structure. It is homogeneous, it is not granular like a caseous necrosis. Caseous necrosis, it was granular. I'm not talking granular, I'm just saying pink amorphous homogeneous. Pink amorphous and homogeneous mass is seen. So this pink amorphous homogeneous mass is described for fibrinoid necrosis or fibrin. So this is the fibrin or fibrinoid. So fibrin or fibrinoid necrosis, we can see a vessel wall which is covered with the fibrin. How you'll identify fibrin? It's a pink amorphous homogeneous material on vessel wall. So this is the fibrinoid necrosis which we will see in vasculitis or malignant hypertension. So now we can see this is the picture, beautiful picture of the blood vessel wall, right? So I am showing you this is the outline of the blood vessel wall, right? And you can see this is the lumen. Inside the lumen you can notice some RBCs, some inflammatory cells, right? So that is not to be focused upon. We should focus on these areas. You can see these are the pink areas. You can see these are the pink areas. So this is the pink area. So what I am marking with arrow, the pink areas. These pink areas are amorphous, homogeneous pink areas are fibrin plus immune complexes. So this is the fibrinoid necrosis. So this is how we will identify fibrinoid necrosis. Important topic. Question was asked in this All India exam 2019. So keep that in your mind. This entire topic is very important. Not the fibrinoid. Entire topic of necrosis is important. Some question may be asked because you can see what I have told you. There was a question of fat necrosis in All India 2016 and now in All India 2019. So that is how we have to anticipate what will be the future question or which topic is important for the future exam, right? So we have seen about fibrinoid necrosis, right? Now we will see, now we'll move to the next important discussion, how we are going to discriminate necrosis versus apoptosis. So what is the difference between necrosis and apoptosis? Before we move to the next topic, which is apoptosis, I just wanted to give you a salient and important discriminating feature between necrosis versus apoptosis, which is very important for exam as well as concept, right? So in this you will notice that what happens in necrosis, right? What we have to understand in necrosis, because of the increased lysosomal permeability, enzymes are released and these enzymes, when these enzymes are released, what they are going to do? When these enzymes are released, what they are going to do? They are going to cause cell membrane damage, right? So now they will be causing cell membrane damage or cell membrane rupture. So if there is a cell membrane rupture or damage, right, cell membrane damage will be present in necrosis. That is the important thing we have to understand. So cell membrane damage is there. So if cell membrane is damaged, what will happen? What will happen? After cell membrane damage, cellular content will leak outside, right? Cellular content will be leaking outside. Whatever were inside, intracellular content will leak outside, and when they will leak outside, they will be behaving like a chemo attractant and they will invite inflammatory cells, right? So after cell membrane damage, intracellular content will leak outside, and because of this leakage of the intracellular content, there will be presence of inflammation. So there will be presence of inflammation. So inflammation will be always present in necrosis. So these are two very important points we have to keep in our mind. In any necrosis, there will be presence of cell membrane damage, there will be presence of inflammation, right? So these 2 points we have to keep in mind so that we can compare with apoptosis. What will happen in apoptosis? Apoptosis, basically it is due to increase in mitochondrial permeability. So apoptosis, mitochondrial permeability will be increased and enzymes will be released, and these enzymes will be causing damage of the cell, but in this type of damage of the cell, membrane will be intact. What I want to say that cell membrane is intact, a very famous and very often repeated questions in All India and AIIMS both exam, right? So in apoptosis, because of the mitochondrial permeability, cell membrane will be intact. So this point we have to keep in mind. Cell membrane is intact. All India and AIIMS both exam, this question had been asked recently. So cell membrane will be intact. So now you can assume that if cell membrane is intact, intracellular content will be inside the cell, and when they are inside the cell, there will be no inflammation. So there will be no inflammation. So because of this, there will be no inflammation. Another question which had been asked in AIIMS and All India both recently, right? So there will be no inflammation in apoptosis. That was the important question which examiner had asked in All India exam. So there will be no inflammation. This was the question in AIIMS also. In apoptosis, inflammation is seen. So that was a false statement, right? That was false statement, because in apoptosis there will be no inflammation. Why there is no inflammation? Because membrane is intact. Membrane is intact, right? The last point is about necrosis. Is it pathological or physiological or both? So answer is necrosis is always pathological. So this point also we have to keep in mind. Necrosis is always pathological. Always. Necrosis is always pathological, right? So necrosis is always pathological. This is important thing to understand. Always pathological. But when we see the apoptosis and we discuss about apoptosis, so apoptosis is both physiological. Apoptosis is both physiological and pathological, right? So this is very important to understand. Apoptosis is both physiological and pathological, both physiological and pathological, whereas necrosis is only pathological, right? So this is how we can understand this topic of the necrosis. Now next topic which we are going to discuss is another morphological spectrum which is both physiological and morphological, and that is apoptosis, right? So next topic what we are going to discuss is apoptosis. So this will be our next topic which we are going to discuss.